So gifts for humanity. Here is the comparison. This is a study that I'm going to discuss very quickly. The summary is this, and after this summary, actually, this study is done as well. They've compared the efficacy of Moderna, Pfizer, and Johnson & Johnson against the hospitalization, and here is the result. Moderna's efficacy from March till August, 93% against hospitalization. Good efficacy. Pfizer, 88%. And an important note here, Pfizer after 120 days started reducing in efficacy. So the Pfizer, when they keep saying that, hey, our efficacies, our antibodies are waning, our efficacy is reducing, maybe they need to review their product. So Pfizer efficacy, and in this document, it says that Pfizer's efficacy numbers dropped after 120 days because they started dropping in the protection. Johnson & Johnson, 71%, 71%. You would see throughout this document's theme that Johnson & Johnson protects less, has less antibodies produced as well. So it kind of it loses out. But also remember, it is one dose, it's not two doses. The other conjecture that the researchers made, it was their conjecture, they do not know actually. They said this difference between Moderna and Pfizer, there are three possible reasons. One reason, of course, as we discussed, that Pfizer may be because its antibodies start waning after 120 days. That may be one reason. The other reason they said was that it is possible that Moderna has 4 weeks gap between the two doses and Pfizer has 3 weeks gap between the two doses. Maybe that is the reason that Pfizer's protection is not as high as Moderna. And then the third thing they said was, and they said it is entirely possible that the cohorts that got Pfizer versus Moderna, they were different, and maybe Pfizer folks were more healthy compared to Moderna. Moderna was healthy compared to Pfizer, and that is what they did not actually look at. So there could be multiple reasons, but this is it. If you just wanted to stop and say, hey, what was the efficacy against hospitalization? 93% by Pfizer, 88%, 93% by Moderna, 83%, 88% by Pfizer, and 71% by Johnson & Johnson. Now I'm going to go in a little more depth of the data. So what did they do? What researchers had actually done was they looked at the data within the full surveillance period, that was March to August of this year, 2021. And they compared all of them, and that is what we just saw. They also compared from day 14 of the second dose, this is Pfizer and Moderna, to day 120 from the second dose, 14 days to 120 days. And they assessed the efficacy during this time. Then they also assessed the efficacy after 120 days. Again, Pfizer and Moderna. Johnson & Johnson, what they did was they assessed the efficacy after 28 days of the first or of the full vaccination. So they actually compared further, and look at the comparisons result. Let's look at Moderna first, this side. Moderna, throughout the duration, March to August, 93% efficacy. First 14 to 120 days after the second dose, 93% efficacy. So it held up well. And then after 120 days, 92% efficacy. So it held up well. Look at Pfizer now. Full surveillance time, March to August, 88%. And see why that's reduced. The first 14 to 120 days was actually good efficacy, 91%. But then after 120 days, Pfizer's efficacy started reducing. And look, it went down to 77%. That is why when these two were accumulated and done the math on, this became 88%. So Pfizer in the first 4 months actually did very well. And then it started waning while Moderna held its ground. That means, in my opinion, from this study, if somebody who is worried that they may be hospitalized, maybe. And one more thing, this is a study not done in children, and this is a study that does not include immunocompromised patients. This was adults non-immunocompromised. So there is somebody who is an adult and non-immunocompromised, maybe in an age or have other comorbidities, and they are worried about what vaccine may be the best. Moderna has the best. It holds on to the efficacy longer than Pfizer and Johnson and Johnson. Okay, so Rima says, "Why not give us a shot today?" Okay, so then the second, the last one, Johnson and Johnson. Through this period, March to August, against hospitalization, 71% effective. After 20 days of the full vaccination, so full vaccination means the first dose and then about 20 days after the first dose, and that is a full vaccination. So they are then counting 20 days after of that, because it's a one dose vaccine. So there is a tricky way to look at it. The efficacy dropped to 68%. So for the whole period, it was less. For the period after 28 days of the full vaccination, it was less as well. So that is interesting, that Johnson and Johnson did not do very well compared to others. Still, it held up. Remember that the threshold for efficacy was 60%, so it is above that. But my wife has Johnson Johnson, so when I looked at this data, I started thinking that do we need to go for Moderna booster? But anyways, this is the deeper dive in the data. Now, they thought in the document that is it a vaccine dose gap that changes this efficacy, or is it the cohort that is different? And they said we did not look at the cohort, so maybe there is a problem there. And then they said that it is interesting that Pfizer's efficacy dropped after 120 days, and that bigger drop caused overall average to drop. Okay, so I've discussed this before. Now continuing. This is a very interesting point. They also did study the amount of antibodies and the type of antibodies created by all three of them, and they measured them. And they saw how do they stand up in the bigger picture. So what they did was they actually looked for three antibodies. They looked for antibodies against nucleocapsid, the nucleocapsid, that is the protein present inside the virus, and that is wrapping and protecting the messenger RNA of the virus. They also looked at antibodies produced against the spike protein, anti-spike IgG, and they also looked at the antibodies produced against the receptor binding domain, or RBD. And they measured them as well for the three vaccines. But there is an interesting thing. There has been a question very commonly asked that, hey, what is the antibody level that we should say that this is the level that means I am protected? So there are two interesting comments. I'll make them here. One is, even in this document, the authors say that there is actually no immunologic threshold that has been decided to say this level of antibodies mean protection. So the medical community doesn't know what is the right level, and it actually makes sense. Every person's body is different, it behaves different, and so they may have different levels of antibodies and still take care of themselves. So it is not necessary that everybody has to have 1,000 to be able to take care of it. Some people would have 200 and take care of it, and some people would have 10,000 and take care of it. So that is one comment. The second comment I'll make a little later, which is very interesting as well. Now let's look at the antibody levels. They published two results: anti-RBD antibodies, receptor binding domain, the dangerous part of the spike protein that binds with the AS2, and anti-spike protein IgG or antibodies. Look at this, Moderna. Median antibody titer 4,333. Now, please remember that Moderna is supposed to be a little more symptomatic. The side effects and symptoms are a little more intense as well. Maybe it is a stronger vaccine. 4,333 international units for the antibodies. For RBD, for anti-spike antibodies, 3,236 median. So good numbers. Pfizer, 3,217 for RBD, which is also a good number, but lesser than Moderna, and 2,983 for anti-spike protein, which is also a good number, but lesser than Moderna. And look at the poor Johnson & Johnson, Janssen. Now, please remember this, with these numbers, they were still able to handle hospitalization or be effective. The vaccinated folks with Johnson & Johnson were still able to be protected from hospitalization by 71% efficacy. So it's not that these numbers just mean it is bad, but numbers were really low. 57 for anti-RBD and 59 for anti-spike. And authors said in this document, and I would request you to look at this document, authors said in this document that there can be two reasons for this. One is maybe Johnson & Johnson actually does produce less of a response. And second is the number of people participating for the study which were vaccinated by Johnson & Johnson was small number. I think it was 17 or so. So maybe the sample size was so small that they could not see a better picture. Okay, continuing. Antibody analysis. So this is my second part of the comment here. What they did was they said we used VPlex SARS-CoV-2 panel 2 kit. That is a kit they used. And they reported the numbers in the international binding units. That is the BAUs, are the antibody titer numbers. But that's not interesting. What is more interesting is this. 11.8 BAU. Any person who had antibody level at 11.8, they excluded them, and there were two such folks. They excluded them as, hey, you were previously infected and you have already gotten protection. We cannot add you in the vaccinated group survey or in the placebo group. That is interesting. So 11.8 for these researchers, 11.8 BAU level is supposed to be a previously infected and recovered person. So that was an interesting thing for me. So with this, that is the discussion for today. I think I did a good job of doing it fast enough. I'm going to come back for the chit chat in a minute. Please do me a favor. Please like, subscribe, and share. Number one. And number two, if you would like to support this work, there are 3 links in the description. You can buy me a coffee, or you can become a patron, or you can use PayPal to support me. Thank you very much, and I would see you in a few minutes. Bye-bye.